Welcome to the Outcomes for Health video to demonstrate the solution which supports delivery of COVID vaccination services. This video describes the process for a local vaccination service model using a sole practitioner. A separate video is available for vaccination centres. Information that appears in the service is subject to change as further clinical information becomes available, but the process and information flow is accurate. To begin, go to outcomesforhealth.org using any supported browser. Enter the username and password that you have been provided with. Click on the Services tab. Tick the Focus Services page for COVID-19 box to provide a clearer view. To start a new record, click here. If you are operating as a sole practitioner, choose this as the clinic type. If you are operating a stage service with multiple practitioners, choose this as the clinic type and see the vaccination centre's video for the correct process. Information for the patient concerning lawful data sharing appears here. Enter the minimum patient details here to search the Personal Demographics Service or PDS. You can toggle between patient details or NHS number as the search term using this button. If a PDS match is found, click Confirm Patient to populate the record with these patient details. If no match is found, you may need to enter additional information, either given name or postcode, to narrow the search. Once the patient details have been PDS validated, a tab appears on the right-hand side of the screen, enabling you to access the SCR with one click if you have an appropriate smart card connected. Enter a telephone number that can be used in the event that the patient needs to be contacted after the vaccination. If the patient agrees to receive post-vaccination information by email, such as the patient information leaflet, batch number information and aftercare advice, record their consent here and enter their email address. If the patient would like to provide an emergency contact, you can record this here. The screening section begins with information returned from the National Immunisations Management Service, NIMS. If seasonal flu vaccination has been administered, the date of vaccination will appear in this field. Please be aware that some private vaccination services do not instruct GP and NIMS notification, so may not appear here. If the patient has received a COVID vaccination previously, the date and vaccine type will display here. Recommendations and alerts will display below the NIMS information returned. Please note that the messages shown here are placeholders showing how the alerts and recommendations will appear. These will be finalised when full clinical information about the vaccines is released. If the patient cannot be vaccinated, the non-vaccination section will appear. Record which dose was not administered and the reason. Any additional notes can be typed here. Please don't include any identifiable information, as these notes will be visible on audit reports. Mark the provision as complete and save the record. If the patient is clinically suitable for vaccination, the consent field now appears. Record the patient consent and whether this was given by the patient themselves or by someone else. If requested, enter the name of the authorising clinician. Once consent is recorded, the vaccination fields will appear. Enter the name of the person administering the vaccine. If they are the same as the person logged in, you can use the Me button on the right. Record the dose sequence. Click the Scan button if you are able to scan the vaccine barcode to populate the vaccine information fields. These fields can also be populated manually. Enter the use by date by clicking into the date field to reveal the calendar. Record the injection site and route. A warning appears if you do not select the recommended injection site. The time of vaccination can be quickly recorded by clicking the Select Current Time button. When the vaccination stage has been completed and all appropriate advice provided, tick this checkbox. If there are no adverse reactions to report at this stage, mark the provision as completed by clicking here and save the record. On saving the record, a GP notification will be queued to send via Mesh if the receiving surgery is using an accredited system, or via the fallback option of NHS Mail. In the unlikely event of a surgery not being able to receive notifications by either of these methods, you will be prompted to print and send a paper copy of the GP notification. Post-vaccination information for the patient will also be queued to send at this point if they have provided an email address. If you need to record an adverse reaction after the record has been saved, you can recall the provision record from the Services page in the following ways. The most recently recorded provisions appear at the top of this list on the Services page. Clicking this button will display the patient name, date of birth and postcode to allow you to identify the correct record. You can also use the search box at the top of the page by entering the patient's name or NHS number. Click on the record and you will be able to add any required information. A SNOMED-coded lookup of reaction types is available here. Start to type a description of the reaction and select the appropriate match. Any information entered here will populate the GP notification message. Remember to save any changes before navigating away. When the record is saved, the patient information and the GP notification will send. Outcomes for Health also transmits a daily audit report to NIMS, with details of vaccinations recorded in order for patient records to be updated.